Hello, I'm Michelle Buckley from Iowa State University. Today, we're going to be discussing selecting does for targeted dry therapy. Dry-off can be an ideal time to set a doe up for success in her next lactation. By identifying animals that have experienced udder health challenges during the current lactation, we can intervene using long-acting antibiotic products within the mammary gland to support udder involution and preparation for the next production cycle. Somatic cell count is the most common metric used to assess udder health. It can be measured directly through dairy herd improvement or DHI test data, or indirectly using the California mastitis test or CMT system. Goats and other mammals shed somatic cells normally in their milk. However, increased levels of cells can indicate inflammation within the udder. When somatic cell count is elevated but no overt clinical signs are noted, for example, swelling, redness, or pain, the condition is called subclinical mastitis. Subclinical mastitis can affect over 40% of a dairy goat herd at dry-off. By tracking somatic cell counts and production metrics throughout lactation, we can identify trends in our goats' udder health. Deviation from these trends may indicate a problem and provide a signal that treatment is necessary. Tracking monthly test data in digital software, even a digital spreadsheet, can make it easier to visualize data and detect changes in production metrics. There are two main tools that are commonly used to evaluate somatic cell count: DHI monthly testing and the California mastitis test. Let's first discuss DHI testing. Dairy herd improvement testing, or DHI, is composed of composite samples from both halves of individual animals' udders. It's recommended that testing be performed every 30 to 45 days throughout lactation. Testing is composed of a laboratory analysis to provide quantitative data for somatic cell count, milk fat, and protein levels. There are also some testing options to provide milk volume data and other parameters as well. The American Dairy Goat Association Dairy Herd Improvement Registry is a performance program based on production data as well as pedigree, functional type, and auxiliary traits. A minimum of 8 tests is required and within 240 days in milk per lactation to be a part of this program. Here's an example of what your DHI test results might look like. You'll see at the top we have the sample ID, which is based on the animal ID, fat percentage, protein, milk urea nitrogen, and finally somatic cell count. Next, let's discuss the California mastitis test. This can be an inexpensive and easy-to-use goat-side test for assessing udder health. We recommend using this assessment tool monthly, similar to DHI testing, in order to obtain serial data points for each animal, which can be used to track trends in udder health. Some producers will treat animals with a trace response or higher, while other farms see the most benefit in monitoring animals with lower scores and only treating animals with a score of 2 or higher. Work with your veterinarian to determine what protocol is most appropriate for your farm. Milk cultures can also be a useful follow-up tool to determine whether the pathogen causing the elevated CMT score is likely to respond to antibiotic treatment. High-risk does are generally considered to be animals that have had 2 or more episodes of clinical mastitis within the current lactation, have had clinical mastitis within the 14 days before dry-off, or does that culture positive for susceptible pathogen such as Staph aureus, Strep agalactia, or non-aureus staph. High somatic cell count or high California mastitis may also be an indicator of a doe that is at high risk for developing mastitis or other udder health issues in the subsequent lactation. A high somatic cell or California mastitis test score varies from farm to farm. Bovine studies recommend treating cows at dry-off that have a somatic cell count greater than 200,000, but this is probably too low for most goat dairies. Farm-specific criteria should be set by the producer in conjunction with the veterinary team. It's also important to evaluate DHI or CMT test data over the course of the entire lactation. By evaluating the herd mean and median somatic cell count, we can identify deviations within the herd and in individual animals at different time points. If there are a few goats with significantly higher somatic cell scores or somatic cell scores that are lower than the rest of the herd, this may help us to differentiate between animals that we should and should not treat with dry therapy. Let's look at an example. On this farm, most of the animals have a somatic cell count above 1 million cells per mil, while several are substantially lower. This producer could use this large gap to define their cutoff for targeted therapy. So animals above 1 million cells per mil would be treated, while those that are below would go untreated during the dry period. In conclusion, it's important to pay attention to trends over the long term. Subclinical mastitis cannot be detected with the naked eye, so routinely collecting and recording udder health data via DHI or CMT scores allows producers to monitor trends over the course of a lactation. Digital records are the best option for preventing data loss and facilitating data analysis. Your veterinarian and extension personnel can help you set benchmarks for selective dry treatment and culling decisions. Thank you for watching today. If you have questions about this module, please email dairygoatextension@iastate.edu.